First, thank you very much for inviting me to give this presentation to your organization. It's a big honor for me. And my topic this night is reevaluation of maintenance fluid intake in horses. So to introduce the topic, I want to explain to you what the purpose of the study is that led me to my present attitude towards hydration of horses. The purpose of this study is to improve our understanding of water needs in horses. These are two very different horses. The one on the right is a top-class racehorse. The one on the left is not. But these are both herbivores with very prominent hindgut fermentation. And because of that, they have very well-developed colons and a tremendous capacity to store water and electrolytes in the colon. So equids in general can survive very well on pasture that's suboptimal. They have very well-developed systems for digestion, and obviously the earlier part of the digestive tract is going to break down and absorb soluble nutrients in the diet. The more critical part is the hindgut. And the hindgut is composed of the cecum, the large colon, and small colon. And on this illustration, you can see that there are lots of arrows going different directions. The arrows that are coming from the bowel, those are absorption. And the ones that are going to it are secretion. Obviously, there's a lot of secretion early on during the early digestive processes. But all that water is coming from the body, from the extracellular fluid space. And it must be returned so that the minimum amount of water is lost in the feces. And to do this, the colon has very effective absorptive systems. And that's true throughout the whole of the large intestine. And so you can see that most of the arrows are coming from the colon and the cecum and the small colon to indicate that these are important sources of water. So the reason that I'm displaying this is to make a point about the importance of water being preserved, used as needed, and being minimally eliminated in the feces. So the horse's intestinal tract is designed to retain these huge volumes of water. Part of this water is consumed. So horses will also drink a lot of water because when they eat, a lot of water is going to flow into the digestive tract and a lot of it's going to be absorbed. But during the process, a lot of that water has to be replaced. And so that brings us to how that happens. Now, owners of horses, and this might be true everywhere, but certainly in the United States, are very concerned when their horses do not appear to be drinking water. And the expression is, you can take a horse to water, but you can't make him drink. And simply what that means is that the horse knows when it needs to drink. When it eats food, it releases all those digestive enzymes and fluid into the gastrointestinal tract. After it has eaten, it will replace a lot of that fluid by drinking water. So a lot of water consumption in horses is driven by food intake. And this is a typical situation, and here's a frustrated owner telling our horse to drink from a nice, cool stream of water. However, the horse knows perfectly well when it needs to drink, and it can't be encouraged to do so. There are some natural systems in place that are obviously going to drive it to drinking when it needs it. And this has led to the development of different products to encourage horses to drink. This particular one is called Horse Quencher, and it's made up of a lot of things that probably horses find palatable. Another alternative is to add some Coca-Cola to the water. But the point here is that you can make all these different attempts to encourage the horse to drink water, and it will not happen unless the horse needs to drink water. So that raises the concern, what are the needs of horses for water consumption? This is not a study I did, but it's a study I would like to do. And that is to get people's opinions on how much water could a typical healthy horse that weighs 500 kilograms require in liters per day. So if I were to ask 100 people that question, how much water could a typical healthy horse require in one day? And the options would be 50 liters a day, 5 liters a day, 30 liters a day, all of the above or none of the above. And you can see that most people, I suspect, would pick 30 liters a day, which is the correct number for a horse about 450 to 500 kilograms that has access to feed. And this horse would probably drink 60 mLs per kilogram per day, or a total of 30 liters. It's unlikely that a horse would drink 50 liters in a day, but some people might think that. And most people would probably think that the horse would never drink as little as 5 liters a day. So those are the values, and those are the options if we were to conduct this study. Again, most people would probably take 30 liters a day. In the hospital setting, we may not allow the horse to drink water for a variety of reasons. One is it might have had abdominal surgery, and we want to reintroduce water very slowly so we don't stress the gastrointestinal tract. So that's the typical clinical scenario. The horse is not getting fed. And there may be other reasons the horse is not getting fed. But the important thing is that we have to give this horse intravenous fluids if it's not getting fed and not drinking water. And these are the typical fluid bags that we use. They're made of plastic, they're sterile, they're suspended from a height, and the water is allowed to flow, or the solution is allowed to flow into the jugular vein at a predetermined, selected rate. And we decide that. So the question is, how much fluid are we going to give this 450 kilogram horse? How much fluid will it require under these circumstances? And remember, please, that this horse is not getting fed. There are many reasons we need to be concerned about how much water horses need. There's always the possibility that they need a lot more than we give them, but there's also the possibility that they need a lot less. And I'm showing you this graph because this bar graph, it's very old. It was developed at the Royal Hospital in London in the United Kingdom, Royal Veterinary Hospital. And you can see that there are different prices for these different items: the total, the consumables, the board, professional fees that would include surgeons' fees, technical fees, and so forth. And then fluids. Blue bars are horses treated with a medical regimen. Red bars are horses that receive surgery. Regardless of treatment, you can see that fluid therapy way out costs any other item on our list. It is the most expensive, one of the most expensive single items that is required in the treatment of a horse with either a medical or a surgical cause. So my hypothesis when we started this study, and I'll go into detail with you on how we did the study, my hypothesis was that feed deprivation will decrease water requirements in healthy horses without adversely affecting hydration. And this is how the study was designed. We had 8 horses. 4 days they were fed, 4 days they were not fed. We used a crossover design so each horse served as its own control. In other words, each horse had a fed period and each horse had a not fed period. And this was randomized. They were healthy thoroughbred geldings. They weighed very similar weights. The stalls were climate controlled, so it was not very hot or very cool. It was just the right normal temperature for the time of year. They were fed hay and grain, 2% body weight twice daily. They had a physical examination and weight once daily. And this study was approved by the University of Florida. So this is just a flow chart showing all the things that were done. Again, climate-controlled stalls. They were put in the stalls for 14 days, and the study period was the last 8 days of the total 14. So we have 14 days, and then we've got all this period here when they were out at pasture, and then they were taken in. Before they were taken in, they had food and water. One group of horses had food and water after they were taken into the stall, and another group had water only. In other words, they were not fed while they were in the stall. This is a summary of our data analysis. The laboratory data was recorded for baseline and 4 days of test. We tested our data for normality and equality of variances. We measured the plasma volume and extracellular fluid volume, and we compared those data with t-test, fed versus not fed. We did a 2-way analysis of variance for potential effects of fed and not fed on different measurements. We did multiple pairwise comparisons, and P less than 0.05 was considered significant. So this is the result of our study. Body weights decreased by 7.4% from baseline, which is not very much. 3 of 8 horses developed mild diarrhea. It was very transient during feed deprivation. So that's probably because feed deprivation altered the microbiome in these horses. Feed deprivation did not affect plasma and extracellular fluid volume, so there was no dehydration, no changes in vital signs or behavior. Most laboratory results were within the reference ranges, except triglycerides, total bilirubin were elevated as expected, and there were some other minor elevations, but within normal range. Osmolality was unchanged. And this is the important part, that water consumption decreased by feed deprivation to 14.5% of the fed intake. So looking at our results, look at this graph, and you can see the baseline morning and afternoon, AM morning and PM afternoon. The densely shaded bar is the fed condition, although these horses were fed before day 1, and the hatched bar is the fasted or not fed condition. And please look at the remainder of the graph. You can see that on days 1 through 4, that the fed horses consumed a lot more water than the not fed. In fact, on a daily basis, they drank almost 36 liters of water, and the most that the unfed horses drank was about 6 liters of water. So a huge difference in the amount consumed. And this is the paper that we wrote on this topic. and it has been published in Equine Veterinary Journal in 2021. This is another paper that was performed by some of my colleagues, but looking at what drives water intake, and what they found to be most important was serum osmolality. The higher the serum osmolality, in other words, the more concentrated the salts were in the blood, the more water consumed. Again, getting back to our diagram here, we believe that what drives water consumption in these horses is a tremendous secretion of water into the gastrointestinal tract for feeding these horses. And then that water has to be immediately replaced. And they do that after they eat by drinking a lot of water. If they're not fed, they don't have these huge volumes of secretion of fluid from the extracellular space. And so there's no great urgency in replacing the water. So now let's return to my question. How much water could a typical healthy horse require in liters per day? Pick one. In other words, if we asked 100 people, I would imagine or presume that it would go like this. That a small number would take 50 liters, nobody would take 5 liters. A lot would take 30 liters because that is the maintenance requirement for a fed horse, but not an unfed horse. Some would take all of the above, none, or some would take none of the above. All of the above is the correct answer because horses function under different conditions. And our horses that aren't eating very much, they're going to be maybe 5 liters of water a day, or maybe a little more than that. But if they're not eating, it's going to be very low. And if they are, it's going to be 30 liters a day. So that's why all of the above is correct. Horses doing different activities are going to consume more water. These pregnant brood mares are very sedentary, but the other horses are hard workers, generate a lot of dehydration and a high need for water consumption. Water is something that we take for granted, but we should be aware that a lot of things we do with horses are going to influence water intake and going to influence hydration of intestinal contents and feces. So this is a very good paper that was written by some of our colleagues in 2015. And they looked at 3 different measurements in these horses. Now, what was done to these horses is as follows. For the first 4 days of the study, they were at pasture. That's P1, P2, P3, P4. For the rest of the study, they were in a stall. The blue arrow indicates when they were switched from pasture to stall. Look at the mean fecal dry matter, percent dry matter per day. It's almost double what it was in pasture after they're placed in the stall. So place a horse in the stall and its mean fecal dry matter will almost double. Mean water intake, that's the middle blue bar. And you can see with that when they go from pasture into a stall, the water intake increases greatly. Now, maybe that's because they're being fed hay. Maybe they're only fed a couple of times a day. But whatever the reason, that's pretty standard feeding practice. And this is what you can expect. And mean fecal output is almost a half on a per 100 kilogram basis. So putting a horse in the stall automatically reduces its fecal output. So there, I wanted to show you on the mean water intake, since water is the topic of discussion here, that green bar indicates how much the horse consumes at pasture, and the blue is how much it consumes in a stall. So I have some conclusions for you. The water consumption in horses can vary depending on feed consumption. This is a normal process. It doesn't mean we have to worry about it. But now we understand it a little better. Another conclusion, this study was conducted on healthy sedentary horses, and the effects of disease, work, pregnancy, and fever could produce different results. So remember that. These are other factors that can affect the results. And this study compared fed horses to horses with zero feed intake. So you can't apply these horses to horses that have low feed intake. For example, if you're feeding them maybe a half or a quarter their normal feed intake, you're going to get different results than you're getting in this study. And so that is the conclusion of my presentation. Thank you.